All right, thanks, Sam. Well, breast cancer is the second most common type of cancer in women. It's estimated that 1 in 7 women born today in the United States will be diagnosed with breast cancer at some point in their lives. And we're now in National Breast Cancer Awareness Month, a nationwide observance dedicated to raising awareness about the importance of early detection. Here to talk more about breast cancer and screenings is Dr. Kimberly Caprio, a breast surgeon at Hartford HealthCare. Doctor, welcome.
Hi, thank you for having me.
Always great to have you. So why is breast cancer awareness so important?
It's important because, number one, it's a very common health issue for many women in our country. About 12% of women, or 1 in 8, will be diagnosed with breast cancer in their lifetime. And it's very easy to detect early and very survivable if detected early.
All right, doctor, what is a mammogram and why is it so essential for women to schedule their mammograms?
So mammogram is our best screening tool for breast cancer at this time, and it's basically a plain x-ray of the breast tissue. We do have 2D, two-dimensional and three-dimensional mammograms, although three-dimensional are widely available in Connecticut and preferable to 2D mammograms because they do have a better chance of detecting breast cancer if it's there.
All right, what if you are called back for a biopsy? What should women expect?
So if one has an abnormal screening mammogram, you may be called back for additional mammograms themselves, different kinds of mammograms, an ultrasound, and possibly a biopsy. Biopsy is a very simple procedure. It's done under local anesthesia, and it's done either through mammogram or ultrasound, or sometimes MRI even. And in that case, the biopsy is done through a very small incision with a hollow needle that is used to take cores of tissue out from the lesion, and then that's sent to the pathologist so we can know what's going on. The final step in a biopsy is that a small little metal chip is left in the breast to mark the area in order to follow it in the future, or if surgery is required to take out the spot, then we can find it again.
That is interesting. All right, talk about how family history impacts the risk of developing breast cancer.
So first-degree family history is probably the highest risk for breast cancer. A person should be aware of their entire family history, even out towards second and third-degree relatives. If there's any history of ovarian cancer in the family, that's also an important thing to bring up to your doctor. And sometimes if there's enough family history, we may even suggest an evaluation by a geneticist to see if there is a gene running in the family that's causing cancers. Any woman or man who is of Ashkenazi Jewish descent should be referred for genetic counseling and testing because the likelihood of carrying a BRCA mutation in that population is pretty much more common than the regular population.
And doctor, I know a lot of people have put off their mammograms. From the stories I'm doing, what would you say very quickly to end this, just to encourage them?
It's a very simple procedure. The technology is excellent. If there's ever a question, you can always come see one of us in the breast program at Hartford Hospital, and we'll be happy to walk you through any questions you might have.
All right, pick up the phone, make that appointment. Dr. Kimberly
Right.
Caprio, thank you so much.
Thank you.